Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited to have the man on. The man. He's called the Dental Practice Efficiency Guy. And before we get into this episode, I'd like to give a shout out to one of our premier sponsors, MetaDenta. In our practice, we use handpieces, prophy handpieces, endo handpieces from MetaDenta. We have a Nifty Thrifty deal with them. And so if you need any of those items, if you have any handpieces that are broken, they have an amazing buyback program where you send your broken handpieces in there, get credit to get new handpieces. So reach out to MetaDenta if you need handpiece help. They are here to hook you up. I think I gave him that name, but pretty much whenever anyone introduced us, I was like, "You're the practice efficiency guy." And I met him. I got introduced to him through some good friends, and he's worked with many DSOs, many practices, so many dentists, helping them be more efficient in the practice. So welcome to the show, the dental practice efficiency guy, Gabe Hofmann. Gabe, what's up, man?
Hey, nice to see you, Glenn. So happy to be here. Thanks for having me. I look forward to talking to you today.
It's funny in the Nifty group recently, one of the moms in there, she's like, "Man, I feel so guilty. I feel so guilty that I missed out on a lot of stuff." And I just, of course, look, I mean, I got a little flack for it because they were like, "You're not a mom." I was like, "You're right. I'm not a mom. I am married to a dentist." Okay. And she is a mom, and I hear what she says. And I always kind
Yeah,
of go
sure.
back to like, hey, I mean, I get it, man. I totally I live it through my wife and myself. And so when these doctors have like these concerns, I mean, I'm sure that helps you to kind of empathize, because you got kids too, and you got a business too.
Yeah. So my wife and I both we worked in dentistry for what, roughly 20 years, right? And I'm still working with dentists.
Yeah.
So I was in operations. I was in the trenches in group practice as working with a consulting company for a number of years. So I got to partner day in and day out and see the struggles. But you're right, the balance, the time balance, right? That's why when I became an entrepreneur, it was to hopefully take that time back. We obviously know as entrepreneurs, uh, that comes in waves
Yeah.
and there are days. But ultimately, right, if we can find that right balance, time is our number one fleeting resource. And so when there are challenges in our business, constant challenges in our business, right, that can take all of our focus.
Yeah.
And that is the primary motivation for my time in operations, all that from what I saw, what I felt, what I experienced in the group that I was a partner in. It's like that absorbs all your time and then time after work. And so that's why my company Activize is in place to really eliminate those log jams, challenges, or pains to give them that time back, whether that's time for their team, right? 20, 30, 40% more time, or that's time for the doctor. Or maybe it's just they're able to sleep better at night, which is
Yeah.
so important too, right?
Well,
So
look, I mean,
that's
when we got introduced to each other, I mean, look, you were introducing me as a dental efficiency guy, and after I've known you for I got to know you a lot better in the past few months, and all the stuff that you shared with me is just like very enlightening. But when we talk about dental efficiency, and you made a couple of comments in the Nifty group as well, it's like, I mean, sometimes it just starts with like the basics, like your team, right? I mean,
so,
you've seen
so
all
important.
those posts, right? Like the doctor, like this teamer is being this and then that. And I just tell people, look, man, I mean, when you look at the dental team and you're like, okay, people sometimes dental practice owners, they treat the team like it's like a group of aliens. Like there's different rules for them, right? And I'm like, you got like kids, right? You got like siblings, right? You got like other, I mean, the team is basically another set of people. You just work in a different
Yeah, so,
environment,
so, so
but
it's so
yet,
true. It's so
yeah.
true.
And then
I,
people like
I
they want to
understand.
treat their team like aliens, like it's something like you gotta separate. I mean, obviously you gotta be professional, right? Like let me take a step back here. I'm not telling you to talk to your team like your buddies, right? But at the end of the day, you're dealing with people. And I love one of your responses that, look, it's basically people, but like, the people that you work with, the practice owners you work with, they have these issues with team. What's your advice to them?
Yeah, I think it's so important. All the great work that we do day in and day out in dental practices, right? For patients, for practice. We can't forget that those 6, 7, 8, 10, however many people are working with us, help to drive that bus, right?
Yeah.
Because we're only we're only as good as the team that works around us, right? And they not only set the table, set the expectations from the time the phone rings, but really every time that patient is passed off beyond that exam or beyond the treatment, right? The team's picking it up. So I try to stress finding the silver lining when if there's a challenge, right? Let's figure out what the opportunity is and focus on the solution as opposed to really focusing on the problem, right? Because the
Love
solution
it.
helps us to move forward, right? And find the positive in that person because it's so hard to have to find another person, train them. The cost, the opportunity cost, as well as the tangible cost is so great. And it's so hard to find good people today. It's like, can we step aside, come from a standpoint of gratitude and opportunity and coach up instead of coaching out? Now, granted, there are times we absolutely have to coach out, but I
Yeah.
think it's so important to create an empowered accountability where team members are holding each other accountable and that where feedback isn't this big, bad, ugly thing. You know, constructive feedback comes from another team member, or we're self accountable, or when the doctor is communicating with their team. It's a consistent thing to coach up so it's not defensive and it's not
Yeah.
attacking and it's not
I mean, I
it's
love
not
all
it's
that advice, and again, not to uh not to get too religious here, right? But like I always feel like one of the best business books and one of the best mindset books is in the Bible, right? And I just tell people, like, okay, when you're giving feedback to somebody, right? Imagine you giving that feedback to yourself. You know what I'm saying? So again, that's a big lesson in the Bible, right? Like if the way you
gratitude.
treat
Yeah.
others the way you want to be treated, right?
Yeah,
And
so true.
so I think a lot of times I think we forget that, like, it's like, look, okay, give constructive feedback. If you go there and you just blast someone, like imagine if someone came and blasted you, right? Like you gotta keep that there too. But I think people also need to understand that at the core of it, people want to do a good job, right? Like
Yeah.
any
Yep.
normal person, I think that's where you need to start, right? Like people always like, I want this, and this, right? I mean, it's kind of like when we were kids, Gabe, like, and we were like, hey, I want this type of car, and it's got to be this, and this, and then like our parents are like, hold on, man, you're just gonna get this used car, it's your first car, it might run, you might have to do your own work, right? Like you got to lower the expectation, but I think a lot of times we're like, we want to get this team member that's like a 10, right? I mean, a
I,
10. And it's like, let's be realistic here, right? Maybe,
yes. Yes,
maybe
so true.
you start out like a 5 or a 6 and you train them up to be a 10, right? But it's hard to
100%.
find a 10. And it's hard to find a 10 with what you want to pay, right? So
Was
again,
talking to a group. It's so true. I was talking to a group when was that? Friday, and specifically about that because they couldn't find that exact person they were looking for. And I said, maybe, can we have an open mind to the things that we're great at coaching and developing? And think about it from the other standpoint. If you bring somebody in that has all this experience and exactly what are they going to fit in your culture? Right?
yeah,
Are they going to grow with the practice,
that
or are they
actually
going
could
to
be
be
a
on an
detriment,
island?
right? If you
Yeah,
get someone in there
correct.
who
Yeah,
feels like they know
yeah.
everything. We actually
Toxic.
you answered a post, like someone was like, this person is so good, right? They were saying in the post, they were like, this person is so good, but they are combative with the team, they're combative with the patients. I'm like, I dude, I already know. Like, I'm not a psychic, but I can already know how that's gonna end when someone feels like they know everything and they want to take control of everything. But that doctor in the post were like, they're so good, but they're
Right.
so good, and that's what you just brought up there, right? Like, what if someone is so
Addition by
good they don't fit
subtraction
the
in that
culture?
case, right?
What are you gonna do?
Yeah.
I
Yeah.
mean, it's been, I mean, again, you and I are sports guys, dude. That is like a story that has been told time after time. Some
Yeah.
great athletes in a team, and they just blast their way out of a
Toxic to the
situation
locker room.
because,
Yeah. Yeah.
you know
Yeah.
what
Yeah.
I'm saying? I mean, that's the reason why sportscasters have jobs, So, we talk about team being efficient, but one thing that you told me, Gabe, not too long ago, we had a conversation. You were talking about like a lot of times practices, we just like to we just like to hoard different tools, right? It's like all these tools. And when I say tools, we're not talking about dental tools, although I can use an analogy there, right? I can use an analogy there again. But again, like we're talking about like, like tech tools like that are, one thing that's doing reminders, right? And then you have this
Of
other
course.
tool that does reminders and also scheduling. And then you have this other tool, this, and then, you were just telling me it's just mind blowing how doctors have multiple tools. And you have worked with people and you gave me this advice too. Like you actually could find a couple of things that does everything and it's also
Yeah.
easier. So talk
So
about
true.
that. Talk about how dentists
Of
we got that
course.
problem, man.
We and not just dental practices or dental groups, but businesses in general.
Yeah.
We have something in front of us, and the easiest thing to do is put a band-aid on it, right? Fill that hole. We need to take care of that immediate need. We're so busy building the business, working in the business, that next thing you know, at some point, we may have 30 or 40. I literally was talking to a group last week. They had 40 different options that fulfilled unique needs. Those 40 different options represent like 75, $80,000
Wow.
in
Yeah. Those
cost.
people forget those options. They seem like they don't cost a lot and adds up. It's almost like, and again, you brought this up to me, and it just was mind blowing when you put it this way. You're like, look at your everyone's personal life. Like how many like freaking subscriptions we have. Like we have so
Yeah,
many
so true.
subscriptions. You're like, dude, if I went in a deep dive, I could probably save someone. And like it just blew my mind because it is easy to fall in that trap, Gabe, because we do that in our personal lives,
Yes.
and it's so much easier. Yeah, I want to put that. I just want to let's just pay for that. Like I don't want to deal with it, and then that adds up over time.
It really does. And then the other thing that takes so much time and becomes very inefficient that we don't realize is that we're putting all those band-aids on our business, right? And they do one thing great or do a couple things great, but then they don't communicate with the next piece of software, the next piece of software. So that workflow that should be a nice circle, right? It works in unison with the trajectory of, well, the patient process as well as the trajectory of the practice. They don't communicate with each other. So then they become a challenge. And a person has to sit there and move patients from point A to point B to point C, or multiple people have to do that. And so that becomes a big time suck or a big challenge for the business, right? And it's something that we don't realize, but it happens because we have all these options that are either proprietary or don't work together. I like to refer to those as silent handcuffs, right? So they limit the ability for the business to continue to grow in efficiency. And and so we like to we let it's really important for processes to be smooth, right? We were talking about recruiting, Glenn, and like if we're bringing a person aboard that we really like, we're excited about, and they have to learn like challenged or broken processes,
Like 20 things.
20 things.
And that's what,
How much more
and
difficult
I
is
mean,
it
there's
going to
no
be to
wonder
learn?
why people say like I hired this person, they can't hack it. I'm like, dude, have you looked at how hard it is? Or some of these practice owners like, well, I can't lose this one person. They know how everything works. Well, heck, they know how everything works because it's so freaking hard.
Yeah, it's like pick that one big hairy goal, right? That one big opportunity. And maybe that's the best place for that team member to start and focus on that when they come aboard, instead of the 120 things that they need to get efficient. But that's really, just a simple strategy, right? We were talking about the thread, and there's so much concern and communication around recruiting and finding the right people. And I think when we have that culture that not only has, simple processes, but we've made it as easy as possible to inspect what we expect, right? Because that's sustainable. If it's hard to go and see reports or see data or have those meetings from a time standpoint, it's unsustainable. So it's really important to implement strategies that just make it simple and easy to keep that workflow growing with the practice. And when new people come aboard, right, if we can train them in weeks instead of 6, 9, 12 months to get them up to speed, there's so much less expense to the business.
Yeah, yeah. Well, one of the things that you are really passionate about, and again, a lot of times, I think doctors need to realize this too. Sometimes we see like a piece of equipment, we're like, dude, I think that looks really cool. Let me just get it, right? But what's really cool about, and again, like I always like to use like car analogies, right? Again, look, most guys, we probably like sports cars, and like we see a cool sports car, it's got all these gadgets and whatnot, or maybe it's like a high-tech car where like we like all these gadgets, I want to get it. And then we forget, like, okay, what are we using that car for, right? Like, okay, I have if you're a family and you have like family of four, you probably need somewhat bigger kid, and if you have like older kids, you probably need a bigger car. A really small sports car with like maybe like you have like two seats in the back is not going to be the best use. And I think a lot of times we have that approach when we're buying equipment, and you have such like a cool philosophy on that. Because a lot of times we look at the equipment, we're like, I like these bells and whistles. I'm gonna get it. I'm just gonna cram it into my practice and make it work. You have like a different
Yeah,
approach. You have a different approach.
it's
Again, you're the dental efficiency
so
guy, right? You have a different
yeah.
approach. You're like, okay, you have some equipment there, but like you got to see, does it fit in your workflow and what you're trying to do? I probably didn't explain that very well. Can you explain that? Like, so again, a lot of
Sure.
times we're like, hey, I want to get this equipment. I'm dead set. And you're like, wait, hold up here. Why don't you look at why you're getting it and if it fits into your workflow? So talk about that.
Of course. So there is so much messaging and noise, right? We're all distracted by
Yeah.
all the shiny things. All we're pulled in a million different directions. There are some companies that do a really good job of marketing, and don't be fooled by the marketing, because just because somebody has a piece of equipment that was nice when you looked at it doesn't mean that it works in your workflow. Open open networks, open equipment that integrates with everything, and support are two keys that are really undervalued when adding a piece of equipment, because price comes and goes, right? We purchase a piece of equipment, we depreciate it. We have to be able to buy it on the front end. But that maintenance and the support, right? Thinking about a car, if it's in the shop all the time, are we going to be using it as frequently? If that piece of equipment is broken down or we don't know how to use it all the time, there's no value to the practice at that point. And in fact,
Yeah.
it becomes a pain point because we can't use it. The doctor is not happy, the team member is frustrated, and the patient can't get, for instance, the image that they need,
Yeah.
or
Yeah.
whatever that case may be. Right. So the support is so important. From my perspective, the most important for the journey of that piece of equipment. But you also need to look at equipment from the standpoint, it's very important to look at it from the standpoint of growing into it as opposed to where you are right now. Right. So where do you want to be 2 years or 3 years from now?
I
And
mean,
when
you
you're
get more,
investing
you
in,
get more, I mean, you get more ROI out of that, right? Like, I mean, and again, that makes so much sense that a lot of times we don't think about it. You're like, okay, I want to get this piece of equipment and I want to get it to, so I think a very easy analogy would be like a newer office buying a pano and they think they're going to do, but they might do implants later on and instead of getting a CBCT.
so true, because a CBCT is not only going to help you today, you're going to use that to do more than take pans, right? We know
Yeah.
that once it's in there, patients are also going to see it and ask, what is that? And then what about from the standpoint of treatment presentation? Even our best treatment presenters, when they can pull up that image, what's the value for showing the patient that not once, not twice, but three or four times at the different points in the patient journey, right? So we really have to look at the full investment
Yeah.
and the value
I mean, when you're
now
when
and in the future.
I mean, sometimes whenever you want to be nifty thrifty, you got to play the long game, right? Like you might have saved a couple of bucks if you were like, I'm gonna get a pan right now. And then what in a year or two you turn around and buy a CBCT? That's not the best use of your money. Now, if you invest a little bit there and you're able to use that CBCT for extra years, and all of course, going back to what the dental efficiency guy just said himself, like making sure that it goes within your workflow. What stuff you're using right now? Again, you could buy CBCT and maybe it's like a certain brand that only is plays well with different types of software and you don't have that software. Well, that expensive piece of equipment became astronomically more expensive because you got to buy more stuff. So again, I
It's
think it's a
true.
lot of
It's
times there's
true.
so many things that we don't think about. But it's always good to work with someone like you. Now, before we talk about like how our members, obviously you're a part of our group, guys, he loves DMs. Just DM the man to death. Like send messages to him. But Gabe's got like a value add because I asked him. I was like, can you help us out? Help us be more efficient. Before we get into that, I do want to kind of talk about your background there. So again, Gabe just didn't wake up like one morning says, "Hey, let me reach out to Glenn. I'm just going to be the dental efficiency guy." I mean, you got like a little resume there. Just tell us, just share with us like what your experience and how that experience translates to how you're helping us today, helping dental practice owners.
Sure. So I started my career in with about almost 2 decades in operations, various positions from practice administration up to, director level positions from an operations standpoint, partnering with practices on the acquisition side as well as on the de novo side to help them grow the business. And that's really where I gained my passion for team building and empowered accountability. Uh, and then I spent almost a decade, 8.5 years, in national equipment distribution and procurement. So I got to really experience that business and the ins and outs. And to our prior point, that what impact a piece of technology can truly make in a business now and in the future if it's the right fit for the practice. But yeah, in the
I
I
mean,
I
dude,
now
you
have.
got like, I mean, you got like it's almost like a, I would say like a kid's lifetime of experience right there, right? Like over 20 something on years. And again, I was excited about bringing you on because it's like, look, you see the posts in there, and you've jumped on the post. I'm like, look, we got to get the dental efficiency guy, the guy who has so much experience with not only just efficiency, but just understanding like different types of equipment and whatnot on this. And so I just want to let everyone know that I kind of needled the man here. I was like, dude, you got to give us some kind of like hook us up here. So, Gabe, you're doing like you're offering this cool 15-minute consultation to help um, optimize practices and get them more efficient. So tell us
Yes.
about that. Tell us like how people can take
Yes.
advantage of that. Again, I just want to let y'all know I twisted this guy's arm. I was like, you can't just give us a bunch of good info and just walk out the door, right? You got to hook us up there. But tell us about like you have like a form or something, or you have something for them to fill out and just kind of see where you can help them out.
Sure. So we have a quick and easy, it's about 5 to 7 simple questions that we will provide for you via a link. You complete those questions and we'll jump on a 15-minute call, and hopefully I can add value to you and your practice, answer some questions or help, because really that's what we do. We love to do best is help uh, you know, large practice owners, group owners and beyond. But we have that link. And if beyond that call, if somebody is interested in taking a deeper dive into their practice, we're more than happy to help from that standpoint too. But that initial call is free to
Hey, I
all
love
Nifty
that. That's the
members.
Nifty Thrifty way right there. I mean, and
That's
again, I just
right.
want to let you guys know that Gabe is, I met him because so many other DSOs and practices have used him as a consultant. And I'm like, look, man, I got to bring you on. I got to bring the dental efficiency guy, practice efficiency guy on our show here. But just to let you guys know, he said the magic word there. It's free, right? It's a free consultation, 15-minute consultation. All you got to do is fill out his form because he can't help you unless he knows what's going on there. And I can promise you guys, like that 15 minutes you can spend is going to be super impactful. But Gabe, before we jump off here, man, first of all, I want to thank you for jumping on. I want to thank you for hooking us up with the consultation. But what are some words or pieces of advice that you want to leave with everyone before you jump off here?
Sure. Thank you so much for having me today, Glenn. I really appreciate it. I've enjoyed our time together. I will ask if you guys take the time to fill out that form. I look forward to connecting with you. This process is really about establishing relationships and adding value to you and your practice. So if we can do that, I'm more than happy to, and I look forward to speaking with all of you. And like I said, look for the silver lining with our patients, with our teams, and happy people are productive people. So let's
Amen to that.
implement
I
more
agree
joy.
with that. Awesome. Thanks, Gabe. All right, guys, we'll see y'all next time.